Hi, I'm Dr. Jen, and I'm here to give you the scoop on all the headlines in sexual and reproductive health that are dominating your group chat. This is Doom Scroll.
Hi, it's so nice to see you again.
Hi, Annie. It's great to see you too.
I wanted to talk to you a little bit about sex and consent today. At my university, I work for our consent training organization. What do you think about mandating consent?
It's incredibly important for people to learn how to maintain healthy relationships, really understand how they can intervene if they see something that's not right, and help people at the end of the day that unfortunately might have experienced, sexual violence.
Can you tell me about the Yes Means Yes training course at Columbia?
It again gives students, faculty, and really anybody who wants to take the course the information to have in terms of, again, knowing what is appropriate in terms of a healthy relationship, as we were talking about, and how to be an aid or be of assistance if there ever is an issue or something happens, not only to them, but to somebody that they might be with.
How many states is sex ed mandated in currently? And do you think that they're doing a good job with their programs in all those states?
I believe it's 39 states plus DC that are mandating sexual and HIV education. There's a lot of misinformation out there. So when you're coming up with programs on sex ed, it's really giving students the right information about reproductive health and sexual development. It helps with knowing what safe sex practice is. There's a lot of new things that come up in medicine and in health, and we need to stay up to date. Teaches a lot about consent. I know you and I have talked a lot about the importance of consent and what does that mean? What's passive consent? What's active consent? So that people in a relationship can come to mutual agreement.
Is there leading research that dictates kind of how we should change the narrative around consent or how colleges should best go about it?
All the things we've talked about, making sure that they know how to respond to things like sexual assault, teach them again about consent, fostering a culture of respect and open communication, making sure that there's no fear of retaliation, right? That unfortunately still happens. And we have to foster people feeling comfortable bringing up things if they're not comfortable.
What do you think are the key takeaways that people should remember about consent?
I think that the most important thing is that consent has to be given willingly. It cannot be coerced, and it has to be an active choice of everybody involved. We also have to stress that consent has to be affirmative. A yes has to be clearly expressed as a yes, and a no clearly expressed as a no, and a silence or an absence of a no does not equal consent.
Hopefully, as this continues to roll out, more and more people it will become a baseline of education for everyone.
Absolutely. It's great to chat with you, Annie.